Okay, so the next thing we're going to talk about is the menstrual cycle. We're going to talk about some general reproductive and sexual physiology. Okay, first thing you need to know is menarche. Get out your vocab notebooks, put in menarche. Menarche is the onset of menstruation. The average age is around 13. The range that's considered within normal limits is probably around 8 or 9 to 16. More girls tend to be concentrated around that average age of 13. The initial cycles are usually anovulatory. That means they will have bleeding, but they have not actually ovulated, irregular, and mostly painless. Okay, as the hormones really kind of get going, get ramped up, and get into a regular cycle, then that person will begin to ovulate and may begin to actually have some menstrual cramps and become more regular. Okay, now I want to talk about the menstrual cycle. So let's look, share my screen. This diagram shows what's going on with the endocrine system and the hormones, okay, and with the ovaries and the hormones they release, and with the endometrium. Here's another one for your notebook. The endometrium is the lining of the uterus, and it's a really fascinating tissue. It thickens and builds up and then becomes ischemic, dies off, and sheds, and it does that in cycle throughout the reproductive lifespan of that person. So the reproductive system is very unique in a lot of ways. So there are things that you don't necessarily expect to happen with most tissues that we see happening with tissues in the reproductive systems. When we talk about the menstrual cycle, we're not talking just about the time of bleeding, that's menstruation. We're talking about the entire cycle from the onset of bleeding in one cycle all the way up until bleeding begins in the next cycle. So the average menstrual cycle is 28 days. There's a lot of variation, okay? Day 1 is the first day of bleeding. So at that point, estrogen and progesterone levels are very low. That's actually what triggers that bleeding, the drop in estrogen and progesterone. They're very low. And because those are low, remember that negative feedback loop in the endocrine system, those low levels trigger the hypothalamus. The hypothalamus releases GnRH, gonadotropin releasing hormone. Okay, so the hypothalamus is triggered by low estrogen and progesterone to release GnRH. Okay, GnRH goes to the anterior pituitary. It releases FSH, follicle stimulating hormone. Okay, this is called the follicular phase when we're talking about the endocrine side of things. So follicle stimulating hormone. What do you think follicle stimulating hormone does? Well, it stimulates some follicles. So those follicles are in the ovaries. So the FSH stimulates the development of several Graafian follicles. So primary follicles are contained in the ovaries. When they're stimulated by FSH, they're Graafian follicles, and that means that they just continue to grow and mature and prepare to release that egg. Graafian follicles, those are the ones being stimulated by the FSH, now release estrogen. So estrogen levels start to go back up. Estrogen causes the endometrium to start to thicken again. Remember, the lining of the uterus starts to thicken. The estrogen levels drop. So the estrogen goes up and then it peaks and drops, and that drop stimulates the hypothalamus again to release more GnRH. This time the GnRH goes to the posterior pituitary and it releases luteinizing hormone. The luteinizing hormone is responsible for the luteal phase. Luteinizing hormone causes the development of a corpus luteum, and it does that by triggering ovulation. So you think this will be called ovulatory hormone, but it's not. It's luteinizing hormone, LH. LH selects a specific ovum for release. That ovum is released, that's ovulation. What's left of that graphene follicle becomes the corpus luteum. Okay, that's why this is called the luteal phase. So we have ovulation, and then that follicle becomes the corpus luteum, and it releases progesterone. Estrogen levels drop, so now we've got more progesterone than estrogen. Progesterone maintains this thick, proliferated endometrial tissue. If fertilization occurs, that fertilized ovum travels, it usually occurs in the fallopian tubes. That fertilized ovum travels down and implants in the uterus about 7 to 10 days after ovulation. If fertilization does not occur, the corpus luteum regresses. So when that corpus luteum starts to degenerate, then the estrogen and progesterone levels stop. Now, there's another thing that I want you to write down in your vocab notebook. The spiral arteries are some very specific arteries that feed the endometrial tissue in the uterus. Okay, that's going to be really important when we get to OB. Okay, the spiral arteries feed the endometrial layer. When the estrogen and progesterone levels drop, the spiral arteries spasm, and that leads to ischemia. So if an artery spasms, the tissue that it's feeding dies, right? So endometrium dies, is shed, we're back to menstruation. Okay, we're going to look at some different phases, okay? And we're going to start with the endometrial part. So when we're talking about the endometrium, the lining of the uterus, there are 4 phases. The menstrual phase is when the person is actively menstruating. That's different from the menstrual cycle, which is the entire thing, okay? The menstrual phase or menstruation is when they're actually bleeding. The proliferative phase is when the endometrium is rebuilding. The secretory phase is when it's just staying nice and thick. That's when the corpus luteum is secreting progesterone. The ischemic phase is when those hormone levels drop and the arteries spasm and it becomes ischemic, and then we return to the menstrual phase. Okay, those are the phases in the endometrium. Now let's look at the hormone phases. In the follicular phase, that's the first more or less half of the menstrual cycle. The primary pituitary hormone is FSH, and it stimulates the follicles. That's the follicular phase. That's when we're ripening these follicles, getting them ready for ovulation. The luteal phase is when the pituitary secretes luteinizing hormone. We ovulate, and then we have the corpus luteum. The luteal phase tends to be 14 days most of the time, pretty consistently. If it's less than that, it actually can interfere with implantation, because by the time that ovum that's released here has been fertilized, divides enough, and is ready for implantation, if this luteal phase is shorter than 14 days, then we actually can end up with early menstruation and not having endometrium to implant. So this is typically 14 days, not much variation. When there is a variation, it can be problematic. This follicular phase tends to stay the same, or tends to vary a lot more. Okay, so there are a few more things that I want to talk about with physiology. I want to put in one more hormone. You've already talked about prostaglandins as a neurotransmitter that carries pain signals, or something that is associated with pain. Prostaglandins are present in menstrual blood, in semen. They're produced by most body organs and including by the uterus. Okay. They may play a role in ovulation, fertilization, labor, and menstrual cramps and dysmenorrhea. They also can affect other organs. Diarrhea is a known effect. So if you've ever heard anyone say that they have diarrhea when they're menstruating, that's not their imagination. It's the prostaglandin effect. Women who are nearing labor also frequently have some diarrhea from the prostaglandins. The next thing I want to talk about is menopause. We talked about menarche, which is the beginning of menstruation. Menopause is when menstruation has ended. The last menstrual cycle is always defined in retrospect. It has to have been at least 1 year since the last menstrual cycle. And we don't know that until it's been a year, because those last several cycles can be very irregular. So someone may have a month or two with no cycle and then menstruate again. As you might expect, that can lead to unexpected pregnancies, because when someone hasn't menstruated recently, they may begin to think that they're postmenopausal before they are. The average age of menopause is about 51, and menopause is the culmination of a gradual decrease in ovarian function and hormone production. So it's not a switch, it's a gradual slowdown. The last thing I want to talk about is the sexual response. We're talking about the physiologic sexual response in both male and female bodies. Okay. People experience sexual response differently, but there are some commonalities, and we're going to talk about the phases of that. This has also been described differently by some researchers. First is the excitement phase. This occurs with stimulation. That stimulation may be by fantasy, masturbation, intercourse, or any other stimulation. The genitals and breasts begin to become engorged due to increased blood flow. That causes vaginal lubrication and preseminal fluid. Okay, preseminal fluid is that fluid that's excreted prior to ejaculation during the excitement phase. Okay. It also causes those tissues to become more sensitive. And there are some voluntary and involuntary muscle contractions called myotonia. That excitement builds until it reaches a plateau. At some point in that plateau, orgasm becomes inevitable. Orgasm involves strong involuntary genital contractions. And it's at this point that we would have male ejaculation. The resolution phase is when that engorgement and sensitivity gradually resolve. Continued stimulation during that phase may rebuild excitement. Whether a male can achieve another erection, or how soon a male can achieve another erection after ejaculation, varies a lot, and it tends to take longer as they age. That tends to be a shorter time for younger men and a longer time for older men. If stimulation ends prior to orgasm, that engorgement will resolve. Now, a couple of things that you need to know, because there's been some misinformation about this for a long time. When we talk about orgasm becomes inevitable, that's about the physiologic response. That doesn't have any effect on behavior. People's choices are still in their control. The physiologic response may not be in their control, but the choice of what to do with that response is in their control. So the other piece, just remember that if stimulation stops, eventually that excitement's going to go away. The other piece is that there's been a distinction made in the literature a long time ago, but it's kind of persisted, between vaginal orgasm and clitoral orgasm for women. There's really no difference. So there's not any difference between orgasm reached by different types of stimulation. Okay, so we're going to move on in the next recording to health promotion and disease prevention.